The waiting area is crowded at CB Dunbar Health Clinic in Bonga, Liberia. Today, Jimmy is here for a mental health consultation.
I've been feeling a long time as good because taking some treatment.
Mental health treatment has been hard to come by as Liberia struggles to rebuild after a prolonged civil war. Now the Liberian government is implementing a new mental health plan, and the Carter Center is working closely with the Ministry of Health to train a mental health workforce, provide support for family caregivers, and combat social stigma against people with mental illnesses. The effort includes expanding mental health services in community clinics like CB Dunbar, run by Medicine du Monde and the Bong County Health System. Clinics like this help patients like Jimmy. Registered nurse Peter Cawley has followed Jimmy's progress.
He was very aggressive at the beginning, and for each time, sometimes he will relapse, but now he's stable, he can come for his medication. Sometimes he becomes confused, but at least it's much better than before.
Medication, consultations, and support from his father help keep Jimmy stable. Janice Cooper says the Carter Center initiative will provide families with strategies to become better caregivers.
Family support is a big component of what we want to do. And that includes supports in helping them to understand how you manage someone with mental illness, how you help someone with mental illness function, how you encourage them to take their medication and get the treatment that they need.
But getting treatment can be tough when stigma and misconceptions about mental illnesses exist.
There are a lot of myths around how somebody becomes affected by mental illness, and there are a lot of myths about how you go about addressing mental health conditions.
One common myth in Liberia is that mental illnesses are caused by witchcraft. Jimmy believes he was witched.
Destruction happened to me in Guinea. I went Kwanga, one of my friends, make a chum medicine on me.
And now stigma surrounds Jimmy because of his illness.
That's no friend. Everybody running away from him.
Stigma is a huge problem in Liberia as it is around the world. It is our intent to work with the Liberian people on reducing the stigma and discrimination against people who have mental illnesses, and certainly debunk the myths and misunderstandings about mental illnesses.
And what we hope to do is use traditional mechanisms for educating people, such as drama, such as cultural societies, working with instruments at our hands, such as broadcasting, narrowcasting, such as texting. With education and with the appropriate treatments, we can show that people with mental illness have a biological disorder or have a behavioral disorder that can be treated and that they can function in society just like the rest of us.
Through treatment, counseling, and support, Jimmy is doing just that.
You keep people's yards clean.
Yeah.
And you can make some decent money doing that.
Yeah.
Make good money doing that.
Yeah.
Okay. So how does that make you feel?
It made me feel fun.